it's never going to happen to me, so I'm not going to worry about it. If I don't go to the doctor, I won't find out if something is wrong. It was better not to know. And I can't imagine being more wrong about something in my life. Normal day, felt fine. Went to work at Gilbert. I just felt a little short of breath and thought that was unique. Didn't really think much of it. Went back to work. I started to sweat a lot, and I honestly thought I was having a little bit of a panic attack. But I thought, okay, I'm gonna go home for lunch, just to try to maybe calm down a little bit, lay down maybe. Halfway home, I realized I forgot my phone at my office. And I remember thinking, it'd be really bad if I'm having a heart attack and I don't have my phone. So I went back to the office. Coworker was there, and he just said, "You don't look very good." And he said, "I think we need to go to the ER." And I told him no. I said, "It's fine, it's just a pain." Because all of my pain was on my right side. And they always, TV always tells you, heart attack is pain on the left side, on your left arm and that. And I didn't have that. I had it down my right side. And it wasn't a pain that took me to my knees. It was just a nagging, uncomfortable feeling. So my coworker drove me to the ER, and I walked in and I told him at the ER, "I'm having chest pains." It seemed like within 10 seconds of checking my vitals, there went from one person in the room to 15 people in the room. They had me on my way to the cath lab, and they put a stent in, and I was awake for that. I remember telling them I didn't want to be asleep. It seemed like in no time at all I was back in a recovery room, and later found out it was the Widowmaker heart attack. And so it was very fortunate that Dr. Widowmaker was here and they were able to clear it so quickly. Quite literally walked out of this hospital 21 hours later.
Unfortunately, these days we are seeing a lot of younger people have heart attacks, and I should say he's one of my youngest patients, and he's one of them, and I didn't say he's my only one, so that's sad to say that, because he's only 48, and I've had some 30-year-olds have, but always risk factors and prevention would be the key to prevent something like that, but some things are unfortunately out of our control.
Dr. Davis and Dr. Widowmaker saved my life, which is very surreal to say when you're only 48 years old that they saved my life, but they did, and then the nurses here at cardiac rehab put me back together. Took me maybe a week to get out of my shell, but it was just, it started slow, walking 20 minutes. The next one, walking on an incline, walking a little faster. That went on, walk on a bigger incline, walk for longer, start running. And by the end of it, I was jogging, I was running, and it just started me on a fitness journey that I've kept going since then. Now I work out 5 to 6 days a week, 45 minutes a day. I feel better than I have in 15 years.
We have an excellent team of cardiac rehab here. You are actually doing exercise and gradually increasing your activity in a very monitored setting. They watch your blood pressures, they watch your heart rate, your heart rhythm, and they gradually increase to get you back to your baseline so that we can say, hey, you're doing well with this, you can go do this regular exercise at home, and I think that's very important in the recovery, and that plays a major role, and I think is as equally important as what we do in the procedure room.
I was somebody forever that I feel fine. I don't need to go see a doctor. I don't need to have a yearly checkup. I feel fine. There's nothing wrong with me. I don't need to go get my cholesterol checked. I don't, you get that notice from the doctor that says it's time for a yearly checkup. Oh, I'm 43 years old. I don't need that. Yeah, I did. And so as you get older, you have to be more vigilant about taking care of yourself. And I have a daughter that's a freshman in high school and a daughter that's a freshman in college, and what am I doing if I'm not taking care of myself? It's just a scary experience and if I don't learn from it and grow from it and improve from it, then it was just a wasted opportunity. And you only get one life, and I don't intend on wasting that opportunity.